The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to this special event in the month of April on the Autism Network. I am Shannon Penrod. I am a proud pony that is a parent of a neurodiverse individual, and I will be your host for this next hour, what we assume will be an hour, but we may go a little bit over. We have assembled, and you can see on the screen, a stunning array of experts to talk about research findings surrounding toxicity and the effects of lowering the body burden caused by toxicity on preconception women and pregnant women. We will also be discussing the effects of lowering the toxic burden on babies, children, teens, and adults, specifically those on the autism spectrum. The focus of this discussion is on the health and well-being of all of these individuals. Before we begin, this program was recorded on an earlier date to premiere in April of 2025. But as you're seeing this, the chat is now open and there are people standing by to take your questions during this live airing. We are premiering this show on YouTube, Facebook, and Twitter. But later today, the podcast version, the audio version of this will be available on all podcast platforms, and it will be available for a free download. If you are someone who would like to receive the download without any ads playing, you have the opportunity to do that by visiting glow.fm/autism live. When you subscribe for $5 a month, you are able to get everything that we do at the Autism Network, including Ask Dr. Doreen and Autism Live, and you will get it ad-free directly into your inbox. Otherwise, please enjoy the free download. All right, I've got an illustrious panel here, and I want to introduce them one by one. These are amazing people with amazing credits to their names, so please know we've taken great pains to shorten it to a reasonable amount, but I apologize to them because they've done so much more than what I'm about to say. For those of you who watch the program regularly, you will not be unfamiliar with this amazing woman. Dr. Doreen Graham-Pichet is a distinguished psychologist and board-certified behavior analyst, doctoral, so she's a BCBA-D, who has dedicated over 4 decades to advancing autism treatment and research. Her pioneering work has significantly influenced the field of applied behavior analysis, ABA, and improved the lives of countless individuals with autism spectrum disorder. On a personal note, I want to say that my son is one of those individuals. She is the founder and once again the owner of the Center for Autism and Related Disorders. She is also the founder of Autism Care Today and the co-founder of the Autism Network. She currently serves as a CEO of CARD and on the board of directors for the Forum. David Humphrey is a seasoned attorney and CEO with a distinguished career leading both clinical and environmental laboratories. David is the founder of the Forum and co-founder of the Autism Treatment Network, in collaboration with 17 leading hospitals, including Massachusetts General Hospital. David's work has been instrumental in shaping the path for health within the autism community, including founding Medical Academy of Pediatric Special Needs, MAPS, and Medical CME Training Company and leadership roles at the Autism Society of America and Autism Research Institute. He is currently serving as the CEO of Purity Labs. Dr. David Berger, known to all of his patients lovingly as Dr. David, is a board-certified pediatrician who has gained a national reputation for his expertise in holistic pediatric primary care, with specialties in nutritional and lifestyle therapies for autism, ADHD, and related disorders. He also specializes in immune dysregulation in children and adults. Through his work with his patients, Dr. Berger designed and implemented testing and treatment protocols, which would become the basis of what is today the P2i program. He currently serves as a respected member of the P2i faculty. Dr. Jean Conry is the past president of the International Federation of Gynecology and Obstetrics and the American College of Obstetrics and Gynecology. She spearheaded the U.S. National Maternal Health Initiative, focusing on reducing maternal mortality. She is a recognized leader in the field of reproductive health and environmental policy. She also served as an OBGYN at Kaiser Permanente. Dr. Conry currently serves as the president and CEO of the Environmental Health Leadership Foundation and is a program director for P2i. Dr. Nate DiNicola is a board-certified OBGYN affiliated with Johns Hopkins Health System and serves as the telehealth chair for the American College of Obstetricians and Gynecologists. He also chairs the International Federation of Gynecology and Obstetrics Environmental Committee and is a recognized leader in telehealth and mobile health. He currently serves as a program director for P2i. And last, but certainly not least, Lee Grossman currently serves as the chair of the board of the forum. Previously, he served as the president and CEO of the Autism Society of America for over 11 years and as a board member of the Federal Interagency Autism Coordinating Committee, as we know it, IACC, for over 12 years. Mr. Grossman also has served on multiple nonprofit boards as well as advisory boards through the National Health Council, the Centers for Disease Control and Prevention, and the National Institutes of Health. Notably, Lee is also the parent of an adult with autism. Welcome, everybody. Boy, that was a mouthful. I'm tired, and now I'm going to let you talk. But welcome. We're so thrilled to have such an amazing group of people. I want to start with David Humphrey. I think for a basis for this conversation, I would love for you to tell us about P2i, what the P2i project is, and why it is so important, and especially to this conversation.
Good. Thank you so much, Shannon. We really appreciate you putting this group together. P2i is a project of the autism-based forum, the Forum Institute. And the Forum Institute is now focusing a lot of its activities the last several years on this critical period of the first, let's say, 1,300 days prior to pregnancy, during pregnancy, and the infant care for 2 years after the pregnancy. The forum includes everybody on this panel. They're either board members or on the faculty, and I'm incredibly proud to be with this group. Doreen was a founder with me of the forum, and so was Lee, and David has been with us from the very beginning. So what are we trying to do? Why is this important? I want to go back to a bit of the history. Dr. Rimland, who I was the attorney for many years and is sort of my mentor, and told me, make sure you get to know Doreen. She's to be trusted and super bright. That was early on in 2000. And he said the first revolution in autism was these kids didn't come from refrigerator mothers. That was in the 50s. And it just blew up the world because he basically established that. The second revolution was these kids can be treated. And many people here in your audience, Shannon, don't remember back in the early 2000s, the medical community and most of the scientists believed that autism could not be treated. It was incapable of being treated. And Lee was with us in 2003. We were in front of IAC with Margaret Bowman from Harvard Mass General and Richard Fade. And we challenged the notion because that IAC board was to say, our future agenda is research only. Autism cannot be treated. And what we intend to do is investigate the genes that are with the fetus and abort the fetus. Exactly what they did with Down syndrome, where today 80% of the children with Down syndrome are aborted in the United States and 92% in Europe. That's where the autism movement was going. Many of the children today would not be here if that would have continued. We were at that meeting, and Margaret Bowman said, these kids can't be treated. I've treated them for 20 years. They respond beautifully. And Richard Fade, who was on the forum, said, I have a child with autism. He was the number 2 guy at Microsoft. He said, my child has done well. Dr. Rimland in 2008 said, there is a third revolution. The revolution is prevention. If the environmental impact is causing these medical conditions and is causing what we see is so many behavioral problems. It also is the key to prevention. And how impactful would that be if we reduce the rate? And without dealing with prevention, we are not going to be reducing the rate, not just of autism, he said, of all the chronic diseases. How prophetic, right, Lee? In 2008, the revolution he announced in 2008 was prevention. And he said it will not work without the support of the parent community. That's why we're here today. The time is now for the beginning of this third revolution. The revolution is if you, during the first 1,300 days, restrict the toxicity, restrict the environmental metals, improve the nutrition, we will see a significant difference in the pregnancy outcomes, right, Jeannie? The pregnancy outcomes proven by NIH sponsored studies of $1 billion. And Doreen, you're probably not even aware of some of this. 5,000 women, 3,000 in Puerto Rico, reduced toxicity during their pregnancy period, dramatic differences in pregnancy outcome. So we know that the evidence is there. And Jeannie and Jose Cordero and Nate just wrote an amazing 100-page book. And so what we need to do now is discuss today, how do we begin this new phase of the revolution involving all of us, not just the panel here, because it never would have worked, right, Lee, with treatment, just with us goodies. Mm-hmm. It was the entire community, the doctor network that formed, the autism treatment network with universities, the publicity we formed. This is where we're at today. And the last comment is the very instrumental person all along on this is David Berger, who I met with 20 years ago. And he said, I not only treat autism, but I'm working on preventing autism by doing the same thing I do with the child. I'm treating the mother during the pregnancy. He has a lot to say today. I cannot tell you how important the other two colleagues are here, Dr. Conry and Dr. Nate DiNicola. If any of you remember how hard we had time, right, Doreen? We didn't get anybody from the American Pediatric Association giving us the time of day. They wouldn't even come close. Now we have, leading this third revolution, some of those very leaders, and Jeannie has brought in a lot of other people in the medical community, and so has Nate. I tell you, this will not work without that support. So I'm honored to be here. So what happens if we don't do this? The rates of chronic disease explode to $1 trillion a year in cost. We are not going to be treating these kids. It's not going to be, we're not going to spend $1 trillion. We will start talking about abortions again. We'll start talking about no treatment again. And if you go outside the United States, these kids are going to be in institutions. We have got to begin this now before it's too late.
Thank you so much. And I want to reiterate, if somebody came in late, this panel of people are about the health and well-being of individuals on the spectrum before they're born and after they're born. Want to make sure that we address that. Dr. Conrad.
Right, I'll just make one more comment. This is not about preventing autism. It's preventing the damage done to all individuals during pregnancy, things that restrict their potential. I think the autism genes produce some of the brightest kids on the planet. Doreen, you can talk to that. Some of the brightest kids on the planet, and the parents are some of the brightest people I know. So this is about improving the condition and supporting the community. And it's also about improving treatment for children that are with autism as well. They've got to deal with their toxicity while they're individuals. So I'm sorry for chiming in on that, but I didn't want to leave without that.
We want to hear from you about that. And you talked very eloquently about P2i and sort of, forecasted what we're going to talk about next, because Dr. Conry, I would love it if you would talk with us a little bit about ECHO and the PROTECT programs and what specifically those two programs we're looking at.
Thank you. And Shannon, thank you for facilitating this meeting. It's wonderful to meet you virtually, and my greetings to all of the participants. As David Humphrey just said very eloquently, he summarized preconception to infancy. It is an initiative that improves the health and well-being of women and children. And there are two parts of it that are very well established. We know if we improve the health of a woman before she conceives, we improve pregnancy outcomes. So that's very well accepted. And we know if we provide, for healthy, safe, and healthy pregnancy, we improve the woman's health outcomes and the child's health outcomes. So those we've really grown to accept. But it's the third element of the initiative that we're really focusing on, because this third element is what brings us here today, to improve the awareness of clinicians and the public alike so that they understand how environmental toxicants exposures impact the health of a pregnancy before, during, and after pregnancy. It affects the fetus and the child. And what we're trying to say is we need to make sure that we interpret the science for clinicians. And that's what our role is. For clinicians, we've got an incredible amount of research that's taken place with the funding of the National Institute of Environmental Health Science for 30 years. The NIEHS EPA Children's Environmental Health and Disease Prevention Summary that was released in 2017 is the most incredible document. And we've used that as a basis for our recommendations for clinicians and for the lay public. Over the course of 30 years, they've awarded, I think, 46 grants, 24 research programs. And when we look at it, we've got ECHO. I know all these acronyms can get overwhelming. The environmental influences on child health outcomes, which aims specifically to look at all the broad range of environmental exposures and their influence on child health and development. So it's the outcome of a pregnancy and then following up those children for many years. And the fact that it is funded through NIH is just been incredible. They're dedicating their learning. So we're taking that information and saying this is the basis of our recommendations on how to avoid toxicants and how to really to approach all of the exposures that we have. And then protect is particularly important because it is it's again funded by NIEHS and it looks at the very vulnerable population in Puerto Rico. This population has the highest preterm birth rate in the United States, and their contribution was to look at the environmental risks that are caused by contaminants, look at the exposures, and then improve children's health by mitigating or reducing exposures. And what we've learned for them is when we take a population, we can provide them with guidance on how to eat, how to minimize exposures to toxicants, what to do, and we can improve pregnancy outcomes. So the PROTECT study has just been a phenomenal, really a wealth of information that we can provide. So what we're saying is the information is critical for guidance for clinicians and for us to provide for our patients alike. It is research, it is science, and it's guidance. So it's like the trifecta, if you will. Thank you.
Thank you so much. Now, Dr. Grampiche, I want to turn to you because you've been working in the field of autism for over 40 years. And I want to know for you, because you've had a front row seat, when did you begin to see the effects of toxins on your patients?
Thank you, Shannon. And I want to first say I'm really honored to be here with all of these amazing people in the group here who are interested in the same things that I'm very interested in. It's interesting you asked about that because I think it was a very gradual process of becoming aware that there's an effect on autism that is really related to toxins. And obviously that's partially because there are lots of different types of toxins. And so it was, my first exposure, I would say, was in the late 70s, possibly, where I had a family that I was working with, and they had 2 children on the spectrum. And the mom discovered that both children had been exposed to high levels of lead. And when they detoxed from lead toxicity, we saw a very, very quick withdrawal of the symptoms that sort of made them classify as autism. So I think it was then that I began to realize how neurotoxicity could really mimic the symptoms of autism. And because, obviously autism right now even is diagnosed based on symptoms. And a lot of the symptoms of neurotoxicity alter development in very similar ways. So over the years, though, of course, I became really, really interested in seeing how organophosphates, pesticides, can disrupt neurodevelopmental pathways, how they can increase oxidative stress and increase inflammation in the brain. And I have been talking about this in my world, which is the behavioral world, for I think over 20, maybe 30 years. And it's, it's a much more difficult environment, I think, because there's still not a lot of understanding of how at least some forms of autism relate very, very closely to neurotoxicity. And so for me, it was very exciting to become part of this movement because I feel very strongly that the earlier we can find these sources of toxicity and the sooner we can change some of those, the better the outcome, right? And just looking at some of the work that the folks on the screen with us in this group have been doing and how they are able to alter these symptoms that come up in our kids just by altering the toxic exposure has been just incredibly exciting for me to see.
Amazing. Thank you so much. I want to turn now to Dr. David Berger, who is widely recognized as the most experienced physician when it comes to applying the P2i principles. For over 25 years, in fact, you've been creating and perfecting these protocols. We'd love to hear from you. What are some major findings of the P2i project?
Yeah, thanks. And thanks again for having me on. And I'm so pleasure to be joined with this such esteemed panel here. So when I started seeing kids with autism, so going back to about 1998, and within a couple of years, when families started showing treatment improvements, when we would address the microbiome, when we would address being exposed to different types of toxins, heavy metals, pesticides, looking at nutritional deficiencies, and our kids started showing significant improvements, that they said, well, maybe we have these issues ourselves, and can we run these tests, and can we consider some of these treatments? Maybe that can affect our outcome, because we know that having a first child with autism, that there's about 1 in 5 to 1 in 6 chance of having a second child on the spectrum. And I thought that was of course, very logical question to ask. And I said, of course, we have to do that right away. And so we did that and have seen quite remarkable, that to the point where I have seen about, I think it's 2 kids total. So we're about, right now, if it's one, so I'd say out of 150, so, less than 2-3% of are we seeing that relative to the national average, having their second child, let alone not seeing people develop ear infections and asthma and allergies and autoimmune diseases, because I adopted this practice wide and started families, and a lot of families came to me. And the interesting thing is now, at least the people who come to me, they know about all of the issues with the plastics and pesticides and nutrition and proper filtration of water. And so for a certain extent, it's like preaching to the choir for me, but they don't know how to do it. They know that these are bad. And so when we started finding, problems with the microbiome, especially if children were on a lot of antibiotics, especially if the mother had a C-section, and unfortunately leads to that sometimes. But we know that if a child is missing out on that first dose of microbiome passing through the birth canal, maybe that's having an impact. So those were some of the things. And then as I kind of got into it within a decade, I also started realizing that vitamin D and zinc deficiencies were almost ubiquitous through the population. It's very uncommon that I see a patient, or for that matter, a mom who's wanting to do this, a family who's willing to do this, have the values normal. And I see iron deficiencies a lot too. So once we started addressing those root cause things, then we started seeing very, very improved outcomes. And I tell people that in my primary care practice, I probably have the most boring primary care practice, and I love it that way. I mean, we do checkups. I mean, of course, we do sick visits and we do everything that we need to do as a primary care pediatrician, but it's incredibly uncommon that we see kids developing really terrible things. And so it's a joy.
Amazing. And we can't wait to hear more because I want to make sure that everybody knows before we're done, we're going to talk about some things that you can possibly change today that could change your health, change your child's health, change your unborn children's health. We'll get to that. But right now I want to go to Dr. DiNicola, who's joining us from outdoors, and you're doing a great job. It's all working out. Some of the things that Dr. Berger was talking about, how are those findings mirrored in projects, the NIH funded projects like ECHO and Protect?
Yeah, I'm outdoors just trying to avoid some of that toxicity inside, clean, fresh air. I think a mirror is a interesting word to link these, because whenever an audience, particularly a medical audience, I think, is coming into a topic for the first time, it's kind of a funny mirror that we look through. The connections are often warped or distorted, and the findings can kind of be dismissed as anecdotal, one-off, small pilot projects. And I just want to be very clear that everything I'll be talking about here throughout our session is really the opposite of that. It's mere in the sense of a direct reflection. So the connection between environment and health could not be more clear. And from both NIH-funded projects like the ones you mentioned, ECHO and Protect, as well as many other policy writings that I've done in research, we're talking about level one evidence. And level one evidence is the opposite of anecdotal. It is consensus statements brought together by a broad coalition. They are systematic reviews that bring in numerous other also high quality studies. And probably the body of work that I can point to the most would be a group called Project Tender. It's TENDR, Targeting Environmental Neurodevelopmental Risk. And this is a group of toxicologists, health professionals, patient advocates, clinicians like myself. And they got together and said, where really is the state of the evidence on these environmental toxicants and how they impact developing brains in the fetus and in young children? And the threshold is very high for including any studies that pose a risk. But the threshold also included some practical realities, which is, when do we know enough to act? And based on this group getting together, they brought really, we have a great panel here, magnified that by tenfold for the kind of scientists that were weighing in on this panel. And they said, for these, they listed 5 groups of chemicals, things that are familiar, I think, to any audience that participates in this kind of work, things like heavy metals, things like pesticides, things like air pollution with PM 2.5 and ozone. And they found that to a very, very scrutinizing lens, these studies were valid. They showed a clear connection between the environmental toxic risk and not having the child or the adult reach their full potential. And they show that we know enough to act. We know enough to be avoiding these. We know enough to be counseling. We know enough to be giving the message to health professionals and patients that this is far beyond a possibility or kind of warped, potentially funny mirror connection. This is a direct translation of the science. And often just that knowledge is empowering. Just the knowledge of having your own agency to avoid certain things is a lot of what we talk about, at least in my world of obstetrics. We do give moms a lot of no's. We wish we had more direct treatments, but a lot of times it is a list of no's. But the flip side of that no is the KNOW. Knowing a lot does provide empowerment. So we're here to provide a lot of that knowledge to as wide of an audience as we can reach.
Amazing. Thank you so much. Lee, I want to turn to you now. You've been waiting patiently, and as a parent and an outspoken advocate for the health rights of individuals on the spectrum, this is a moment in time, right, where the research is in and we can improve outcomes for pregnant women, and we can improve health for individuals currently on the spectrum. What impact do you think this information will have on our autism community for both those that identify as being neurodivergent and the family members and parents who love those individuals? What do you see coming?
Well, first of all, thank you, Shannon, for having us on this show. It's an amazing topic. To me, this is among the most important issues I've ever worked on in my life. And let me go back a little bit, because David and I share a long history of working within this community and working with Dr. Rimland, who really was the thought leader in so many of the developments that we're implementing today. Dr. Rimland was founder of both the Autism Research Institute as well as the Autism Society of America, and he had great influence on both of us. And one of the things that he was most adamant about, and one of the things that we adopted quite early on at the Autism Society of America in the 2000s, was this, I'll call it, at the time it was a notion, but it is a fact, that autism is treatable. So at the Autism Society of America, we took that very important concept and started applying it to everything that we were doing, because we wanted to find solutions to what was going on in that child's where they were at that time, and how we can impact them across their lifespan. And at the same time, we were seeing this tremendous rise in the numbers of individuals being diagnosed with autism, and nobody really had a clear understanding of it. Controversial at the time, we introduced the notion, and we had people from NIH, CDC, patient advocates, professionals in the field join with us to publish in the Autism Advocate Journal a fairly a consensus statement showing that the environmental factors were directly contributing to the rise in autism. And at the time, it's very controversial, and let's just say that people weren't very accepting of it. It was about 2 to 3 years later, with both the CDC and the NIH were saying the same thing, listing environmental factors as, for the majority of people being diagnosed with autism, as the primary cause. These exposures were happening to them. So how are we going to treat this? Well, as a patient advocate, I feel very strongly that industry, our government, should be protecting us. They should be providing us with clean water, clean environment, foods that are safe to eat. Unfortunately, that's not happening. So what are we going to do as advocates to change this? Well, through the forum and the P2i program that we've developed, we are now developing ways that we can test to see what the toxic load is on individuals. We felt that the greatest impact that we can have is to develop these tests and ways to intervene before a woman becomes pregnant, during her pregnancy, and then monitoring her and her infant throughout, in the way of changing that trajectory of having poor outcomes and improving their health over their lifespan. So that's really the impetus behind this. Again, in the 2000s, as part of the environmental aspects that we introduced, we also talked about these health-related issues, providing proper health care, providing treatments to people with autism, as well as all people with disabilities. And we developed a program developing global rights for individuals with disabilities and autism, so that message would get out and be heard. What we're doing at the forum is, as advocates, is we are wanting to work with the government. We are wanting to work with industry to show them that they can develop, for the same cost as what they're doing now, clean products that will help all of us and impact all of us. Now, how will this impact the autism community and the neurodiverse community now? Well, it's the same thing that I would say to anybody who is trying to live a healthy lifestyle. We have some answers for them. We don't have all the answers, but there's ways that and methods that can be employed to improve their health, and by improving your health, you're going to have better outcomes and a longer life, and avoid some of these chronic health conditions that are so troublesome in our communities today.
Amazing. I want to pause for a second because we've talked about the what now, and when we come back, we're gonna show you a short video about some of the programming that we're doing during the month of April here on the Autism Network. But when we come back, we're going to really dig in and talk about what are the things that you can do today, empower parents and individuals. What can you change today to improve your health? And then we'll also talk about action steps to let the world know the things that we're talking about today. So stick with us, take a look at this.
It's that time of year. April has finally arrived. This week we have all new shows. On Monday, Shannon welcomes Peter Prokop and Tommy Camano, co-directors of Traveling the Spectrum, now on Peacock. Then on Tuesday, we have a new Ask Dr. Doreen, where Shannon and Dr. Doreen will answer questions about outcomes and what is possible. On Wednesday, you won't want to miss a very special episode with a panel discussion on P2i Public Health. On Thursdays and Fridays, we are excited to introduce Autism Live in Spanish throughout all of April.
Buenos días y bienvenidos a Autism Live. Soy Shannon Penrod.
This Thursday's show covers how to support a child with ASD when things go bad, and on Fridays, Shannon explains how to get compliance the right way. Join us at 10 a.m. every day throughout April. The Autism Network, providing information and inspiration to families for over 14 years.
Welcome back. We are here today with a group of incredible experts. We're talking about toxicity. And for this part of the program, we're going to talk about what steps you can take today to start to lower your toxic burden. So Dr. Berger, we have to start with you, especially for the moms out there, whether they're new moms, older moms, or thinking about being pregnant again. What actions do you recommend that they take right now to lower their body burden?
Yeah, and it's a wonderful question. And education, by far and away, is the most important thing. And one of the things that we're also doing is creating handouts and other types of things that can be given to people. And we are getting to a point where we're going to start being able to test for all of these toxins. And so we can be more specific. But let's face it, we all should be minimizing our burden of the plasticizers, whether it's the hardeners of the BPAs and similar chemicals, the softeners of the phthalates. We can all be understanding what produce has the most pesticides in it, referring to the Clean 15 and Dirty Dozen from the Environmental Work Group. We can be understanding about what types of things, whether it's fish or other things that may have heavy metals. We're finding out these in baby foods that they're discovering lead and arsenic. But having this information out there is incredibly important so people can make the best choices for themselves. How can we properly filter our water and do that in a safe manner without too much wastage of the water? So all of those things can be done, and obviously cost will be an issue for some people, and that's a very difficult thing. But hopefully, as more and more products come online, so that there's more of a supply, because the demand is there. But if the supply is increased because we're certifying products that are safe, we're letting people know how to get these products, that will be really helpful. In addition to that, everybody can have on their insurance should be able to get simple things like vitamin D levels checked, having their zinc levels checked. I'm also one who advocates for understanding the methylation pathways and looking at MTH, FART, whether one can activate folate to methylfolate, which is so important in the production of N-acetylcysteine and glutathione. And if that's an issue, everybody can be taking methylfolate instead of regular folate, which of course a lot of the newer prenatal vitamins already have it in there. And so throughout this type of education, we really can make a difference. And I've seen it in my practice, because more and more, as new families come to me, whether they're because they want to get pregnant or because they're pregnant or have a baby and they're lactating, so many of them are doing these things even before I get a chance to talk to them. 10, 15 years ago, that wasn't the case. So already the education is happening, and they just need more.
Amazing. And for David Humphrey, my understanding is, sometimes we get overwhelmed. It sounds like, oh, I got to take all these things out of my healthcare. I got to take all these pills. I got to stop doing this. And it can seem overwhelming, but it's my understanding that even taking small steps can significantly lower your body burden and have a significant impact. So tell us a little bit about what you've seen in the studies having to do with this, David Humphrey.
Well, I think the clear message is there's a solution for this that's pretty straightforward. And that was done in what Jeannie mentioned, the PROTECT study in Puerto Rico. What they did was they measured 3,000 women for pesticides, for plastics, and for heavy metals. And they put them into 4 quadrants. So when the lady came in, she said, oh, I'm in the 4th quadrant, which Doreen was the most dangerous one. And then they gave her a 1-page thing on how could you get rid of the organophosphates. And then they went out and they did that. And then they came back and they were retested. 99% of them chose to participate. The remaining 99% can't agree on the time of day in today's politics, right? 99% agreed that they would reduce them voluntarily because they were pregnant. And then at the end of that month and a half, they came back. On the average, they reduced them by 50%. And they got down to quadrant 1 or 2.
Amazing.
That was safety. Their preterm pregnancy, their pregnancy complications, damage to the fetus went down dramatically. And they have all the percentages there. And Jeannie and Nate went ahead and just published that. And I'm going to send them to you, Shannon, for your audience. The cool thing is we developed those tests at Purity Labs. I'm putting a pitch for Purity Labs because I knew that unless we were able to measure, we could not manage. So by measuring your blood pressure, you can manage it. By measuring your toxicity, you can manage it. And I worked with a university group because at the time I started, the average organophosphate test, Doreen, was $1,000. So you've got to drive that down into the $100, $150 range for people to be able to afford it. And we're trying to encourage all other laboratories to do the same thing. So what the revolution starts with is measurements. That's what the PROTECT study showed, by measuring the metabolites in the urine. And the last thing is, I just have to mention, there's an absolutely brilliant guy out there that the Autism Committee knows. It's Bob Norverin. He's University of Cal, San Diego. What he is saying is with autism and all chronic conditions, many of them, because of the environmental toxins, their cell is stuck into an autism danger response. It has profound implications because if it's stuck trying to deal with these environmental toxins in the child, they do not learn very well. They do not speak very well. They do not behave very well. And Robert is suggesting it's up to 30% of all the children, and almost all of them with chronic conditions. We have to get these environmental toxins out of these kids that have autism, cancers, attention deficit disorder, or they're not going to get better. We need these cells to turn off and return to normal again. And the cool thing is, Dr. Robert has a lab and he's measuring these things so he can tell whether somebody has this cell stuck on. We are at the start not only of a revolution for prevention, but also a revolution in improving treatment of existing people. The last thing is, Columbia University just did a study of heavy metals. I don't know if you would know this, David, but it was that if an adult, 50 years old, has the highest quadrant of lead, mercury, cobalt, uranium, they increase their chances of all-purpose death by 35%. And clearly it was 40% of all of the men and women's heart attacks are implicated with just lead levels that are too high. These are hidden toxins that exist, toxicity, I'm sorry, Jeannie, toxicity, hidden toxicity that exist in all of us. The fact that they're hidden. And last comment is, I talk all the time to parents that say, I got tested after the birth of the child. I had high levels of lead. I had high levels of mercury. It came from the sushi I was eating. It came from lead in my pipes. We need to get people measured. We need to get people to understand how to reduce them. The cool thing is the PROTECT studies are giving us a very clear path. It is not hard to reduce. It's not hard to identify. But if you don't know what you're shooting at, you're not going to hit it. Okay. So that's not a pitch for Purity getting a lot of testing business. It's the idea that the testing industry has to start focusing on inexpensive and easily available tests globally. And that's what we're attempting to do.
Thank you. Dr. Conry, I want to turn to you because these studies have huge implications for the OBGYN community. What do you hope that community will take from these studies, and what steps are we hoping that they will take as a result?
You know, one of the biggest problems we face is most of this research is simply published in areas that we don't read. It's in the environmental science literature, maybe in the pediatric literature. So it's the education that we've got to get out there to help clinicians understand these exposures. But see, that's our number one concern. Physicians are almost like ostriches. We put our head in the sand until we know how to respond. So we need to get people's heads out of the sand and give them the tools to respond. So as David said, we have a handbook that we put together that takes all of these exposures, shows clinicians what can be done about it. And I believe it's not just the education to help people understand the risks, but biomarkers can provide the feedback and the guidance. So once we have some measurements on our patients, we can give them some advice on what their chemical levels are in certain respects, what their phthalate is or PFAS, any of those, give them feedback on what their levels are, and then provide guidance on how to minimize exposures. And as Dr. Berger said, it's diet, it's exercise, it's health style choices, it's changing how we look at our produce, making sure we're eating organic or rinsing our food. So it's all of those kind of issues that we need to be able to address clearly. But I find most clinicians are just simply unaware. Dr. De Nicola has written a fabulous summary in ACOG providing guidance. We did that in our global literature. So it's helping improve physicians' awareness and then being able to respond well when their patients come in and advocate for their patients, because the patients are often more aware than the clinicians are because they haven't taken their head out of the sand yet. So, and I should say my last thing is I would love our physicians then to be the advocates, because as Lee Grossman said, we've got to see change at the government level. We've got to see change happening, and a clinician is a powerful advocate on behalf of patients.
Let's turn to Dr. De Nicola. We've talked a lot about pregnant women and small children, and David Humphrey just gave us a perfect example about what this might mean for just a 50-year-old who has high heavy metals. What kinds of things are you seeing in the study to suggest that this really has an impact on the health of children, teens, adults on the autism spectrum?
Sure. Yeah, that old phrase, which came first, the ostrich or the egg? In a lot of ways, my role in the medical societies has been linking the pediatricians with the OBGYNs, because as sad as it is to think about, the pediatricians were seeing patients at a very young age saying that this is too early, and how can you be that young and it'd be too early? So acknowledging the link to pregnancy was crucial, and these babies being born pre-polluted was a problem. But really the same mechanism happening there in early fetal development is one of these windows of human development that continues to occur through other points in life. And that would occur during early childhood years, it would occur during teenage years. So anything we're talking about, a heavy metal like lead, we're talking about pesticides from the foods you eat, we're talking about just an abundance of plastics from every single thing you consume, from the water you drink to the fish you eat. All of those would have the same toxic potential at later years. And there's really no age where heavy metal toxicity is not a problem. So the things we're talking about really apply across the board. I mean, yes, it's true. Adults in general perhaps have more resilience than, say, a brand newborn, but the effect is the same. I say this somewhat jokingly. Anybody who's suspicious of government work can note that lead has been found in the pipes under the Cannon House building on Capitol Hill. So, lead toxicity would impair our brain functioning at any age. There are certainly ages that, we consider more susceptible, but if you're looking to maximize your potential, from where you are starting today to where you're going to be performing tomorrow, you'd want to avoid all of these. And the evidence does come through quite clearly that simply removing it by common sense, it removes the toxicity, but by longitudinal studies, at least in the early childhood development, you do see improvements. It's not always a lifelong permanent state. There are gains made even by just simple reductions.
Thank you so much. Dr. Grampiche, turning to you, you have notably helped many children reach amazing outcomes using high quality ABA. but you have also been an outspoken advocate on the subject of lowering children's toxicity and their toxic load in order to partner with ABA to reach those outcomes. But you were often ridiculed by your colleagues in the behavioral community. Are you seeing any change now in this?
Yeah. Thanks for that question, Chad. Yeah, to be honest, the sad answer is no. I still don't really see that much of a change. The ABA community is an amazing community. I don't want to say anything negative about this group of amazing colleagues, because all the folks in ABA, they work very, very hard to try to teach the individuals who've been diagnosed with autism. And ABA, applied behavior analysis, is a part of behavioral psychology, right? So the premise is, don't ask what's in the black box, modify the things around the black box, and you'll get a better response. So it's sort of an interesting parallel when you think about it, because what I try to tell my colleagues a lot of the time is, if you are modifying things that are around the black box, let's say the child or the parent, the mom, then wouldn't the environment and the toxicity in the environment be one of those very, very important antecedents that we need to change, right? And so providing that education, I think, to the ABA community is vital, because there are huge, huge changes we see in our patients when we do give them the appropriate diets, when we do take away things that are, sort of classified as allergens, I guess, for them, or when we do things that are reducing the toxic load. So, and it's amazing. And as you know, Shannon, we published on this, where when you do these interventions, then the rate of acquisition, the rate of learning increases pretty significantly. So there's no question in my mind, sooner or later, we will have a better understanding in the behavioral world. As I said, for me, it's very exciting to be part of this, because I think it'll make a huge difference on the outcomes that we're seeing in ABA when the entire kind of field of ABA accepts and learns and endorses these techniques that have to take place in order to reduce toxicity.
Thank you so much for your guidance on this for so many years. It's meant so much to so many of us. Lee, I want to come back to you because, again, we're at this moment in time, and we need to start talking about where do we go from here? Is the hope for a national initiative? What would you like to see happen now as a result of these studies?
Well, thank you, Shannon. That's a great question. No, I don't have a hope for a national initiative. I have a hope for a global initiative.
Okay.
So there is boundaries that are defined by countries do not limit the environmental exposures that the population has. This has to be looked at as a global issue. We're getting products from, every country is getting product from all around the world that has toxins and environmental issues. And we have to look at it to address all of it. What we're doing at the forum is that we're starting small. We're focusing on what we think that we can change. But as we develop this further, we'll be encouraging and working with industry and hopefully government to incorporate these better environmental ways or employing ways that we can improve the products, make them safer, make them healthier, remove the toxicants that are in there. And the way that I look at this, we're having this conversation right now. The cat's out of the bag. There is no turning back. We all know what's happening. So we have to begin to address it. From that, we're encouraging a movement of people getting together with us to work with the forum. That includes industry, that includes government, that includes patient advocates. We're starting to roll out educational opportunities so that we're bringing awareness to these topics and the ways that the solutions that we know that will work now, and to build the science behind this so that we can broaden the scope of what we can deliver and the solutions that we can provide.
Amazing. I'd like to take just a second. And for those of you who are still treating patients, and I know that isn't all of you, but if you are still treating patients, I'd love to hear from you what effect this has had on your practice. And, how has it informed your practice? Who would like to go first of those of you that treat?
I'll go.
I'll jump in. I'll be real quick, David. Actually, some of the protocols that you guys have developed have been so incredibly helpful to us. Shannon, as you know, with your help, our parent handbooks have changed. So providing this type of education to our parents, to our moms, I think has been a really big change in our practice, especially over the past year or so. So the more you guys can develop, the more we'll hand it out to our parents. It's been very, very helpful.
There we go. Dr. David, I think you said you wanted to go next.
Yeah. One of the fascinating things about all of this is the overwhelming majority of what I know and what I do was parent-led. A parent finding something and asking me, does this sound okay? Is this something that I can pursue? And listening to parents. And sometimes they'll bring me things, I'm like, that does not sound like a good idea. I can explain why, obviously, in a different way, because I'm like, well, no, that could be dangerous doing that way, or not taking this into account, or physiologically, biochemically, that just doesn't make sense. But at the same time, when parents started bringing me information about all of these things and they all checked out, that's really helpful. I found it to be very empowering to the parents, because as somebody who listens at every first appointment, I tell every parent, if there's anything that you hear about, read about, dream about, divine intervention, if you think it's going to help your child, tell me. Let's discuss it. Put it on the table. Don't be afraid. This is an open place. I'm here to listen and to help sort through these things. Because, let's face it, I realize that a lot of physicians have kind of taken an approach that if I didn't learn about it in medical school or at a conference, it can't be true. And I'm like, well, we have had to learn somewhere sometime. And so when you listen to what parents are saying and what they're concerned about, when you hear about a kid not getting better despite some of the things that we've tried to do already, then all of a sudden you'd come up with something. I had this mom who once dreamt that she told me, you told me at the beginning that I dreamt twice about vitamin B2 helping her kid with autism. And she says, I don't even know what vitamin B2 is. I know it's on cereal boxes, but I don't know what it does. And I actually looked back, and there were a couple markers on a urine test that didn't even indicate that the kid needed vitamin B2, but I knew it was water soluble. I couldn't hurt the kid if I did it in a reasonable way. And we put the kid on some decent doses of vitamin B2. Turned out to be the best thing that we ever did in over 2 years of working with this family. And so as long as we're listening, as long as we're able to assimilate and also realize sometimes it's okay to say, I don't know. In fact, I've always said, I don't know is probably the 3 most important words besides I love you. And it's okay. And I think a lot of providers are almost afraid to use that because it shows like a lack of knowledge. And I don't look at it that way, because nobody knows everything. In fact, I tell patients, if anybody tells you that they have all the answers and that they're completely sure, run away from them as soon as possible, because that's just not the way reality is. But we can, let's go through this together. Let's filter it together. Let's get feedback. I'm here. Send me messages in the patient portal. And then when we apply these same principles to women in the preconception, in the pregnancy lactating mode, and then it just makes perfect sense. And again, we have to listen.
Doctors who listen, may that be in everyone's Christmas and Hanukkah stockings. Okay, Dr. DiNicola, I think that you're still treating patients, yes? Yes, talk to us how this informs your practice.
Every day, yeah, and I would just echo what Dr. Berger is saying, that the 3 most powerful words to change a practice would be ask your doctor. I say this with a lot of humility as somebody who writes clinical guidelines, recognizing that all the guidelines we write doesn't change things nearly as fast as having 3 patients in the same day ask you about a topic. Now, as far as what it changes for me counseling patients, the thing is, I probably don't give any different advice than what they might have already suspected, but it comes with so much more definition behind it that it leads to more compliance. So, for example, if I say, don't eat sushi. They kind of already knew that. That was there. It wasn't anything that new. They didn't want to hear that. They were hoping I could say something different, but they kind of knew it. If I say, don't eat sushi or any of these fish, say from the top of the food chain, because they could have high mercury or heavy metals contaminants, and that could create, some toxicity to the developing brain. Well, that's different. If I say that if you get a hookworm infection from bad sushi, whatever kind of fish it is, and while bizarrely that infection won't really threaten the pregnancy much, but the treatment, mebendazole, is teratogenic, it sinks in more. So what I think is really valuable about these kinds of informational gatherings and all the information we can share is that it delivers a very probably intuitive and similar message, but with much more definition and with much more uptake and with much more agency for the patient who's following it, that they think they're not just being, told no, no, no. They're given more things they now know and can act differently.
Absolutely. None of us want that hookworm thing that you were talking about. Dr. Conry, I don't know if you want to chime in on this as well.
Yeah, I think, we talked earlier, and one of our take-home messages when we wrote our first committee opinion back in 2013 for ACOG was how to improve awareness with our patients, but heaven knows everyone feels guilty in pregnancy no matter what we're doing. We always think we've done something and we feel guilty. So we want women to be aware without being an alarmist. And it's really like walking a very fine line on how to achieve that, because women blame themselves for everything. So you want to help support them with information, with guidance, but not feel guilty about the pregnancy, but be aware of all the cautions that we're giving.
Amazing. Thank you. David Humphrey, I want to end with you. We're in the home stretch here. I know you mentioned Dr. Bernie Rimland earlier, and you worked very close with him. For the people watching this who aren't familiar with him, tell a little bit about Dr. Rimland and how his work has influenced this work.
Okay. For those of you that don't know him, Bernie was my mentor. He was the reason why the autism revolution started, 1, 2, and now 3. And Bernie was an incredibly bright and resourceful person, but he also believed one person could make a difference. And when he said, well, if I decide to change the world or change my attitude, I think I'll change the world instead. So what Bernie taught me was he is still the electricity in my lamp. I'm just a lamp. Bernie's electricity. He was the one that had the vision of where to go and the perseverance. He also had an uncomfortable feeling, rightly, of making people feel uncomfortable. So it is, what are you going to do about it? Where is your sense of urgency? Yakety yak, yakety yak. What are you going to do? I'm going to change a child's life. Jeannie has, in the Philippines, the OBGYN's ready to do a countrywide study for $250,000 to implement P2i as a nationwide program. There is somebody listening out there in your audience that says, I want to make a difference, not just with the Philippines, but I want to make a difference. And what I'm urging you to do is, I've got a sense of urgency. People on this panel have a sense of urgency. And I want people that are listening to understand there is no criteria for who gets to join this movement. Richard Fade in 2003 was working at Microsoft. He had a child with autism that got better. You know the story, Lee? He quit Microsoft. He joined the foundation and he made a difference. I'm not sure treatment would exist today without Richard Fade's input and what he did. He was a parent. He felt the pain of what happens if he doesn't do it. So I'm asking your audience, somebody out there can be part of this and make a difference. We need the urgency now. It's exactly like having a busy street, kids getting hit going to school, and nobody thinks about putting up a crosswalk and traffic monitors. We don't want to go another day with kids being hit.
And the truth is, we all can participate, maybe at different levels. You mentioned the Purity Labs and you mentioned the testing. where would people go if they want to know more about getting tested, David?
I was all set to have those tests ready until Jose Cordero of the NIH said, here's our reference ranges. Here are other things we need to test for. And so let's put it back about 3 or 4 months. But in about a month or so, we should have CLIA validated tests and we'll be able to publicize them for everybody. But again, it's trying to encourage getting these lab tests down in cost by making them popular. Everybody should be taking metals tests and tests. So the direct answer is a couple of months we're going to have it ready to go. And that'll be an important part of what we do.
And Shannon, to add to that, I think several years ago when David and I first started talking about it, we said we wanted the toxics equivalent of 23andMe. So somebody could look at this and say, I really need to know this information, and we make it so that it's readily available to them.
Yes, that was my curse, Jeannie. You said it's got to be this price. So it's been 5 years. We worked with the entire university network of mass spec to try to force these numbers down, and it's been a journey, but we're there. I mean, it's an amazing technology. We're able to do thousands of chemicals for a very small amount of money.
So
I know. I had promised it was going to be February, but yeah, there's more to do, and then we'll be ready. Yeah.
All right. I want to thank all of you. Unfortunately, that's all the time that we have today, but I would like to encourage people, if they want to find out more about the forum or the P2i project, please visit www.forump2i.com. I know that David Humphrey had said that he was going to share some studies with me. So if you want to know more, you can write directly to me, Shannon, at autism-live.com. And I can get those out to you. And perhaps we'll make another way later on. But for now, you can write to me, Shannon, at autism-live.com. I thank you all for all your tireless work. I thank you for you taking the time out of your very busy and productive lives to be here and talk with all of this. You are making a difference. You are changing lives. We appreciate you so much.
Okay, Shannon, you're making a huge difference and have got a difference for so many years. I want to thank you for your friendship and what you do for this community. It's an incredible dedication you've had. Thank you, Shannon.
Well,
Thank you.
I'm just a mouthpiece, but I'm happy to be that for all of you. I hope you have wonderful, wonderful months of April. We were able to help lots of people. Thank you so much for your time here. I want to say to all of our viewers, keep watching for more programming throughout the month of April. You know what our mission is here, to provide information and inspiration, and there it is for you right in front of you. We'll see you next time on Autism Live. Give your kiddos a hug from me and one for you too. Bye-bye for now. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and on Instagram for important updates. And please download our free podcast wherever you get your podcasts. Thank you so much. See you next time.